Hello everyone and welcome. I'm Dr. Motahare, and in this episode we are going to talk about constipation with a special focus on natural non-pharmacological treatment options in order to make a real difference. Let's dive in. Constipation is defined as difficult, infrequent, or incomplete evacuation of stool. It's very common in the population, affecting around 12 to 20% of adults globally. Women, elderly, and patients with sedentary lives are more prone to this problem. Beyond discomfort, constipation impacts quality of life, productivity, and also healthcare costs. Constipation can be divided into five main categories. It is important because the treatments are based on the type of constipation. The first one is normal transit or functional constipation. In this type, which is the most common type, the colonic movement is normal. And this type responds well to fiber, hydration, and lifestyle changes. The second one is a slow transit constipation or colonic inertia. This is due to impaired motility of the colon due to some reasons. Often affects young women, and the exact cause is not known. It's idiopathic. Symptoms are very infrequent bowel movement, little urge, bloating, and in this situation, fibers, hydration, and lifestyle changes are not that much effective, and other treatments are needed, like abdominal massage or neuromodulation, plus pharmacological treatments. The next category is refractory disorders. Here, there is a pelvic floor dysfunction. When it's needed to be relaxed, the pelvic floor cannot be relaxed and sometimes just paradoxically contract. Symptoms are prolonged straining, incomplete evacuation, and sometimes manual maneuvers. There is some diagnostic tools like anorectal manometry and many things else that is specific for this type. Non-pharmacological therapies here are biofeedback therapy in the first line and pelvic floor training. The next category is secondary constipation due to medications like calcium channel blockers, iron, calcium supplements, and many other things. Metabolic problems like hypothyroidism, hypercalcemia, neurologic problems such as patients with MS, with Parkinson's disease, or structural problems. Next category is opioid-induced constipation, which is increasingly common in patients with chronic pain treatment. Patients who are under some situations that needs chronic pain treatment, opioid treatment, most of the time has this kind of constipation. Correct classification is essential because management differ between different groups. In this slide, you can see four different types of constipation. Functional one, which is normal movement, a slow transit, pelvic floor muscle problem, relaxation problem, and also secondary constipation due to many problems. A structured approach is key for a correct diagnosis. But first, we should know about the red flags. The presence of blood in the stool is a red flag. Weight loss, very important. Anemia, especially in men or women after menopause. New onset of constipation after age 50. These things are red flags and needs colonoscopy. You cannot ignore them at all. When you just rule out these red flags, then we are going to other things like when was the onset, frequency, which medications the patient is using, systemic illnesses, or some basic tests such as CBC, thyroid function test, glucose, calcium. And then based on the thing that we have in our mind, this is a normal transit or a slow transit, we will use different diagnostic tests that I don't want to talk about them today. Non-pharmacological management start with a good hydration. We need at least 1.5 to 2 liters of water per day, unless there is a contraindications like heart failure or chronic kidney disease, that the amount of fluid should be ordered by the doctor. The second one is dietary fiber, very important. It should be around 25 to 30 grams per day. And we should increase the amount of fluid gradually in order to prevent bloating. The next one is exercise, very important, even walking, yoga, any kind of exercise. Stimulates bowel movements. The next important one is toileting posture. Using a foot stool to mimic squatting, improve recto-anal angle, and facilitate defecation. It means that you should put something under your feet when you are sitting on the toilet. Just put something under your feet to just bring up your feet. Okay, that in this situation, recto-anal angle will be a little more open in order to defecate. The other one is advice for a routine bowel movement after meals. I will explain it completely again. These interventions are first line and effective for most cases. Let's talk a little bit about dietary fibers. Fruits like apple, pears, berries, and prunes provide soluble fibers that soften stool and increase bowel frequency. But fruits like apple and pears should be eaten with the skin. Prunes are particularly effective due to sorbitol content. Vegetables such as broccoli, carrots, spinach, and green beans add bulk and help stimulate bowel movements. Legumes, lentils, chickpeas, black beans are all fiber-rich and also provide proteins. Whole grains like oats, brown rice can help maintain a regular bowel function. Seeds such as chia and flax seeds are excellent for constipation. Chia seeds absorb water, forming a gel that softens stool. Flax seeds provide both soluble and insoluble fiber. So chia seeds and flax seeds are very, very good. They have little calories too. You can eat them without being worried about diabetes and sugar content or anything else. Nuts like almonds also contribute to fiber intake. Not much, but contribute. Important point here is that you should gradually increase this amount of fiber, because maybe you can feel gassy, stomach bloating, and things like that. And when you are eating fiber, you should drink enough water. As I told you, 1.5 to 2 liters per day. It's important. It should be together. These two should be together. Our goal is 25 to 30 grams of fiber per day, but gradually. And unless there is some contraindication, it means that all the things should be under supervision of your doctor. When we eat, A reflex is triggered in our body, which is called gastrocolic reflex, a natural physiologic phenomenon that stimulates the colon and urge to defecate. We want to use this reflex to overcome the constipation. For post-meal toilet training, you should sit on the toilet for 10 to 15 minutes after each meal, ideally 20 to 40 minutes after consumption. It means that you now eat your breakfast, wait for 20 to 45 minutes, then go to the bathroom and sit there for 10 to 15 minutes. For the best result, put something under your foot to elevate your knee in the level upper than your hip. Okay, your knee upper than your hip to facilitate the defecation. You should not strain at all. You should sit there. Even if you have no urge for defecation, no problem. Just do it. The key here is just patience. You should do it every day, every day, every day until that reflex will begin again. Okay, so you eat your meal, for example, breakfast, especially with a warm water, which stimulate movement again. Then wait for a few minutes, go to the toilet, sit there, relax. Your knee should be upper than your hip. Put something under your foot and just sit for 10 minutes without any straining. Then just get up, go and do your daily life. But you should do this every day. Patience and persistency here is very important. It's key. And by the time you will see the effects of this small change, lifestyle change to your bowel habits. There are some other non-pharmacological treatments that your doctor should order and do them, such as biofeedback or transanal irrigation or sacral and tibial nerve stimulation. Some complementary treatments are also available that there are not sufficient data for them, but sometimes they can help, such as abdominal massage. It's an easy thing without any harm. You can just lie down, bend your knee, and gently just massage your abdomen in a circle mode from the lower part in a circle here, and just like that. Gently just massage your abdomen. Some studies tell that acupuncture will help. I don't know about that. Some others will tell mindfulness and stress reduction will help, especially in IBS, irritable bowel syndrome, and patients who their symptoms worsen with stress. These advanced therapies all are based on the patient symptoms. You can use all of them or any of them based on the patient's history, physical exam, and special diagnosis. To summarize, lifestyle changes, hydration, and consumption of fibers are keys. There are other treatments too, like biofeedback, pelvic floor retraining, neuromodulation, and sometimes abdominal massage that we can use them too. But we should always look for probable underlying disorder and treat them. We should have a complete medical history of the patient about the drugs that they use, about the concomitant illnesses. All can cause constipation. If someone's constipation is because of a neurologic problem like Parkinson's disease, the treatment is different. You should know that the treatment of all constipation are not the same. Treatment should be individualized. And also never forget the red flags: weight loss, blood in the stool, What others? Anemia, start of constipation after age 50. If there is any of these red flags, you should do a colonoscopy. Thanks for your time and attention. I hope this video was helpful for you. Stay informed, stay healthy. See you in the next video.